It's always a good time to focus on your health, and November happens to be Lung Cancer Awareness Month. Today, we are joined by Dr. Murty and Dr. Bagai of Ironwood Cancer and Research Centers just to help us understand more about the disease. Thank you both so much for joining us today. This is such important information to get out there. So if I can, Dr. Bagai, how common is lung cancer?
Yeah, so lung cancer is actually the most common cancer worldwide, accounting for almost 2 million cases annually, and is the leading cause of cancer-related deaths. In the U.S., there are approximately about 200 to 250,000 cases annually, which does represent almost about 15% of all cancer diagnoses.
Wow, it is common. Dr. Murty, let's talk treatment. Tell us, how is lung cancer treated?
Primarily with surgery, radiation, or systemic therapy, or a combination thereof. And when I say systemic therapy, I mean chemotherapy, immunotherapy, as well as new drugs, which we call biologics. So it's a combination thereof.
I've actually heard radiation can be used to treat lung cancer. Can you tell us what role radiation plays in treatment?
So in early cancers, in the curative setting, we use surgery typically to remove a lung cancer. In cases where surgery is not possible, or because the patient is not a good candidate, or the patient refuses, we use radiation. We use something called stereotactic treatment, which is a very high dose of radiation delivered in a very short amount of time. And it's very comparable to surgery. In more advanced but curative cases, we use a combination of surgery, radiation, and chemotherapy. Quite often we use radiation and chemotherapy in conjunction. And again, when I say chemotherapy, I refer to immunotherapy as well, and some biologics that Dr. Bagai will expand on later. And lastly, in the incurable setting, we use radiation to palliate symptoms, to relieve, say, for example, pain or bleeding, etc.
Dr. Bagai, technology is always changing. Are there any new developments in the treatment of lung cancer?
So that's a great question. It's a very exciting time right now in lung cancer, where there's been a lot of developments in the field recently. Now, historically, lung cancer is a disease that was predominantly treated with standard chemotherapy. But now, with our improved understandings of the molecular pathways that are really driving tumor growth, there has been a big shift in the treatment of lung cancer, more towards a personalized tumor profiling approach. And what that means really is when a biopsy is taken and a lung cancer is diagnosed, the tumor we send off for what's called molecular or tumor profiling to try and determine what genomic alterations have taken place, to try and find what mutation is actually driving growth of the tumor. And based on those results, there can be an option for oral targeted therapy that is targeting that specific mutation without actually the use of chemotherapy. With those type of treatments, you can avoid chemotherapy and the side effects associated with that. The other big advancement in the field has been something called immune therapies, actually with chemotherapy or without chemotherapy, provided the PD-L1 expression, which is a marker for immune-based therapy, is expressed at a high level. What we're trying to actually do is steer away from standard chemotherapy and provide therapies more on a targeted approach to avoid side effects and have higher response rates.
Well, I have learned so much. Thank you both so much for this important information. Now, if you want to find out more about Ironwood Cancer and Research Centers, visit ironwoodcrc.com or call the number you see right there on your screen.